At the California Department of Public Health, we have a shared vision, a vision to protect and improve the health of all Californians. Every day, public health professionals help shape positive health outcomes for our communities. It's our mission to advance the health and well-being of California's diverse people and communities by building a truly equitable public health system.
The work that we do here has amazing wide impact. Our people every day are doing really exciting, really innovative work that influences not just the lives of 40 million people in California, which is huge, but it also sets the tone and sets example for the rest of the nation and globe in many cases.
We are not just a state agency. We are part of a movement. There are so many roles and programs that contribute to the work we do, from issuing and maintaining vital records to implementing new technologies to analyze data. There is a lot of work that goes on behind the scenes. Public health heroes are everywhere.
We have over 200 different programs that we administer, and so educating the public on exactly what it is that we do is really important because at the end of the day, we're here to serve them.
In 2018, we established the Perinatal Equity Initiative, which sought to address birth outcomes and infant mortality inequities. Every year, we fund over $7 million throughout the state to support families and pregnant people to have healthy births and healthy lives in that first couple of years.
I often say I cut my teeth in public health in my work in tobacco control early in my career. It was through that experience that I understood the value of creating partnerships and networks and coalitions to address health issues. I also understood the value of policies, systems, and environmental change. Indoor air policies, tobacco tax policies really led to the reduction in tobacco consumption as well as secondhand smoke exposure.
One public health initiative that had an impact that I worked directly on was COVID response. And in a very prolonged response of almost 3 years, the amazing work of state and local public health to address the disease. I think it was just a recognition of the ability of state and local health to be agile and change our response based on the information we were gathering on how to contain the disease.
In 2019, we found our first case of silicosis in a countertop worker. And since then, we've had over 100 cases. Some of those individuals have passed away from their disease and others have needed lung transplants. We've issued alerts and educational content to employers, to workers, to healthcare providers to make them aware of this danger and all the things that we could do to protect the workers. We were able to pass emergency regulations that would protect workers. We were also able to work with public health departments to make this a reportable condition. And finally, counties are now considering banning the use of engineered stone as a way to protect these workers.
We are at a pivotal moment. The intersection of public health and communities is where real change happens. We're collaborating with community leaders, leveraging technology, and addressing social drivers of health to build a healthier California.
We work with our local health jurisdictions on a daily basis. They are natural partners because they are in the communities providing services. We also work closely with community-based organizations, and we fund them either directly or through the local health jurisdictions so that they could provide culturally appropriate services to reach communities, as given that they are trusted messengers in the community. We also work with our tribal partners to be able to serve and meet the needs of our tribal communities throughout California.
One of the things that we're doing in our area on the operations side is we're trying to modernize the state's new IT systems. And so you have 61 local health jurisdictions. You don't want 61 local health jurisdictions doing 61 different things. And so we're working on modernizing our team, modernizing our data infrastructure to help come up with a cohesive infrastructure for the state.
Two of the most critical areas in public health are, one, addressing the needs of our youth. I think as we look at the life course, anything we can do to improve health from the very beginning, whether that is home visiting programs, mental health, or any of the other sort of childhood, obesity, nutrition, all of those things really set up our Californians for a better health. Second, I would say, is emergency preparedness and response. As we move in a global economy, that we are going to continue to see infectious diseases at a higher rate. We're also going to see the impacts of climate change. The more we can do to build resilient communities, the better our population health will be.
We can't do what we do without resources for departments or for programs. We really need IT support. So our Information Technology Services Division goes a long way to further our mission. Our Human Resources Division is instrumental in getting people into the right place. Our Contracts Management Unit, our budget folks, our accounting folks, do everything that we need to do to make sure our programs have the resources they need. I just want to be able to say thank you to those folks who are the unsung heroes of public health, who are helping kind of move these initiatives forward behind the scenes. What they do matters, and we see it.
Public health is for everyone. People don't understand that there's so many opportunities in public health, from environmental health, from working in communicable diseases, to health education and health promotion, to being cutting edge in communications and media. And of course, we can't function without our IT system. So public health is for everyone, and really encourage it as a career choice.
We invite you to be part of our mission. Your passion and dedication can make a real impact on the health and well-being of Californians. Join us as we shape the future of public health.